Hi guys, it's Katrina. I'm back again for Move It May. This week Run Through have asked me to come to you today to talk about runner's knee. So for those of you that don't know me, I'm a physiotherapist based at Central Health Physio in London, and I have a special interest in assessing and treating runners, being a runner myself. And I'm coming to you again today from my kitchen due to ongoing COVID-19 restrictions in the UK. So I'm continuing to treat my patients via video consultation. So what is runner's knee? Well, it's a very common condition and running related injury affecting the patellofemoral joint, which is the joint at the front of your knee. So to put this into perspective, when we walk, we put about 0.5 times body weight through our patellofemoral joint. However, when we run, this increases quite significantly to anywhere between 4.5 to 7.6 times body weight. So you can see why it's a commonly injured area. Runner's knee affects twice as many women as men. It's quite a non-specific term which can encompass a whole host of different problems, and there's a debate in the literature regarding what the actual source of the symptoms are. So I've got a diagram here just to talk you through the different structures that can be affected. So it could be the patellofemoral joint itself, which is the joint between the kneecap and the femur behind, and it could be the cartilage in that area, or the sort of synovium, which is the lining of the cartilage and the fluid in there that becomes inflamed, that can cause problems. Often with that, people report issues with doing the stairs, whether that's going up or down, or just direct compression on the joint itself. It could be the IT band, which is the structure on the outer side of the knee. I mean, this can sometimes be a whole other diagnosis in itself. Symptoms tend to be on the outer side, often referred to as ITB friction syndrome. However, that's not entirely accurate because we're not sure that actually friction occurs there. It could just be that this area has become overloaded or inflamed, for example. The other areas that can be included within runner's knee are the quads tendon, which is the tendon above the kneecap there, or the patellar tendon, which is the tendon below the kneecap. And often the pain in these tendons tends to be quite localized. Behind the patellar tendon, underneath the patella, we have what we call the infrapatellar fat pads, and that's a big lump of fat, essentially, which is full of nerve tissue. So compression of that area can cause it to become inflamed. Because it's very nerve heavy, then it becomes very, very sensitive very easily, and things like hyperextending your knees will aggravate that. And also around the knee, we have these little fluid-filled sacs called bursa. They can also sometimes become inflamed and could be a source of symptoms. Okay, so again, runner's knee is another multifactorial condition. Contributing factors could include training error, so a sudden increase or change in load, training volume, etc. Weakness in your quads or your glutes, reduced flexibility in your quads, your IT band, hamstring, calf, hip flexors, stiffness in your ankle, specifically if you're restricted into dorsiflexion, and that may increase stress on your knee. Or running with increased adduction or internal rotation at the hip, so that kind of knock-kneed running style, or that kind of crossing over your feet when you're running, that all may contribute. So as physios, it's important we address someone's strength and control deficits and potentially look at modifying their running gait to get symptoms under control. There's also a lack of high quality evidence for some of the interventions we as physios may use when treating runner's knee. So it often comes down to a bit of trial and error, and what works for one person may not necessarily work for someone else. So what are the 5 most common questions my patients ask me about runner's knee? So number 1, what's caused it? As I mentioned earlier, it's usually multifactorial. Could be a training area, so in terms of sudden increase in volume or maybe increase in hill work. We know that running uphill does also increase the load on your patellofemoral joint. It could be weakness in your quads or your glutes, as I said earlier, or lack of flexibility somewhere. Or it could be your running style. So as I said earlier, that narrow crossover gait, overloading the knee. And it needs to be assessed and treated on a case-by-case basis so we can establish the exact source of symptoms, because it may change how we manage you. So number 2, can I still run with runner's knee? Well, yes, but it's all about modifying your training and the activities outside of training that could be contributing. For example, if you're doing a lot of squats that aggravate it, or stair climbing, which I'll talk to you a little bit about later. I let my patients continue to run as long as their pain is under a 2 out of 10 and settles within an hour of stopping, and isn't worse or stiff the next morning. I may encourage people that have got an event in mind where they need to get their mileage up to break their runs down into more smaller sort of manageable chunks. That may involve doing a couple of runs on one day, but just in a time frame that doesn't aggravate it. I may tell patients to rein in the hill work if that's something that aggravates them. Often it is something that aggravates with knee pain, but not always. And equally, I may also encourage people to take out speed work if that is an aggravating factor. Now, a lot of people do find that aggravating, but some actually find it more comfortable to run at speeds because often you change your foot strike pattern, which could be more comfortable, or also spending less time on the ground. Number 3, shall I use ice or anti-inflammatories? Well, there's some evidence that anti-inflammatories help, so yes. So you may need to take a 7 to 10 day course of anti-inflammatories if you're really acute and you want to settle it down. And some people find relief from icing. As I mentioned last week, the mechanism for why this works is unclear, but if you've got some swelling and it helps, then there's no harm in doing so. Number 4, will kinesio taping help? Well, as I said earlier, there's a lack of high quality evidence for this, but from experience, I find it can be really helpful in the acute stages to get some short-term relief. I don't recommend it for everyone. What I would be sort of inclined to do is test a functional movement like a squat, for example. If that's painful, then I might apply a little bit of pressure in the direction of where I would be putting the tape, for example. If that makes it feel more comfortable, then I would apply the tape and then I'd retest the movement to see if it's helped. If it doesn't help, then there's no point in using it. And no harm in giving it a go, but you have to be careful you don't become dependent on it in the long term. Number 5, should I foam roll my IT band? Again, mechanisms as to why this might provide some relief is unclear, as it's such a thick band, it's unlikely you'll actually stretch it. But where there's a flexibility deficit compared with the asymptomatic side, it can provide you with some short-term relief, and there's no harm in doing it if you get some relief from it. If it is included in your treatment plan, though, it should be used alongside a decent rehab program, which includes some strength and conditioning and addresses your control deficits. If you do have pain on the outer side of your knee, so that kind of ITB friction syndrome pain, then you don't want to be rolling directly over that sore area, as it may inflame it more. And you also don't want to be rolling over the bone on the side of your hip. So sort of staying in the soft tissues in between. And also remember that the fascia blends with other muscles. So it blends with your TFL, which is muscle on the front of your hip, and also the glutes at the back. So actually you may find more benefit from rolling those areas as opposed to the IT band itself, or even the side of the quads. So I'm just going to show you how I would go about doing that. So I'm just going to talk you through how you would foam roll if you wanted to. So IT band, you're going to lie onto the side of your thigh, asymptomatic leg over the top so you can lever off the front foot, hands down, and then just rolling up and down the side of the thigh, avoiding the bone on the outer side of the knee and the hip. And if you find a painful spot, which I often find is about halfway down, just spending a few seconds there, just working into that until it feels like it's easing off a bit, and then just rolling up and down. Wouldn't spend more than about 2 minutes here. And then also potentially coming over onto the side of the quad if that feels tight. So that's a good one there, or even up onto the front of the hip, slightly on the side again, top of the thigh, the tensor fascia lata. So you might need to go a little bit higher there, and come slightly more onto your front. And then, as I said earlier, your IT band blends with your glute muscles. So to roll the glutes, bringing your foot onto the opposite knee, and then just foam rolling in that position there. Okay, so like all these Move It May talks, runner's knee can be a tricky one to manage. So my tips for pre-running, as I've said previously, I'm not a fan of static stretching before running, so a dynamic warm-up is preferable, something similar to the dynamic downward dog and runner's lunge I showed you in my shin splints talk. And as I mentioned earlier, that weakness, particularly in the quads and glutes, is an issue with runner's knee. I'm just going to talk you through some activations you might like to do before you go for a run. So this is a nice isometric exercise for the quads. Very good exercise to do if you're in the acute phases of runner's knee, as it can be quite calming for the knee, and also a good activation to do before you go for a run. So what you need is a heavy resistance band, or you can use the likes of a belt, dressing gown rope, that sort of thing, and you're going to secure that around your ankle. Now, just to note, when you're doing exercises in an open chain position like this, like a knee extension in the gym, the loads on the patellofemoral joint are higher in this first 0 to 20 degrees of knee flexion, okay? So working in this range can be quite aggravating, which is why I'm working this exercise with my knee bent, okay? So you want to be able to work this between about 90 to 50 degrees essentially, but anywhere in that range that's comfortable. So what you're going to do is, against the resistance of the band, push in, okay, and you're going to aim to hold that for anywhere between about 30 to 45 seconds, and I would aim to do between 5 and 10 of these before you go for a run. Okay. So activation number 2 is to try and get your glute med working on the side. Now, I really like sliding exercises for this, especially if you're really overactive in the TFL at the front, because you get a lot more feedback through the ground, helps you fire the right muscles. So I'm just going to talk you through a little exercise I would do to activate those muscles. Now, it's important when you do this that the weight-bearing leg doesn't squat past 45 degrees. So similar to the seated exercise where the load on the patellofemoral joint is more in the 0 to 20 degree mark, when you squat, the load on the patellofemoral joint increases after about 45 to 50 degrees. Okay, so we want to keep the weight-bearing leg nice and comfortable, but then leading with the heel on the opposite leg, you come into what I call a sliding skater. Okay, and you want to keep the alignment good on this leg and lead with the heel on this leg. So you might want to do 20 on that side and then the same on the other, leading with the heel. Okay, and just to show you that from the side so you can see how much I'm bending here. So my weight bearing leg is only bending a little bit, and I'm just going slightly behind because that helps to activate more around my glute med, especially in people that have problems switching off their TFL at the front. So third activation to get your glute max working, which are the glute muscles on the back of the buttocks. Okay, so what you need for this one is a bench or edge of your sofa or chair, whatever's comfortable. And I would just hinge from the tips of your shoulder blades, knees at a comfortable knee bend, okay? And you're just going to drop your hips down and thrust up. So I would do between 20 and 30 of these. And if that feels really easy, you might want to do single leg version, because obviously remember that running is a single leg activity. So we want to try and keep it functional, and you can work in that position with one leg raised. Okay, important with this one not to thrust too high. Shouldn't be feeling the tension in your lower back with that. Okay, so during running, try and think about increasing step rate if your step rate is on the lower side, so anything below about 165. Think about landing soft on your feet, that quiet landing to reduce the load on your patellofemoral joint. If heels are your aggravating factor, then rein those back a bit, the same for speed. And if you're a trail runner and you tend to run on narrow trails, that could also be aggravating, so try to avoid those because they can promote a crossover gait. Post running, I'm happy for you to do some slow static stretching or foam rolling, but obviously tailor it to the areas that feel tight. And ice and use anti-inflammatories as required. As I've said in my previous talks, I always recommend 2 days a week of strength and conditioning included in your programme. So for runner's knee, it's particularly important to include quads exercises and glutes, but obviously don't forget about the other things you may need for running, like your core, your hamstrings and your calves. That being said, if you are struggling with your knee, you may need to modify your strength and conditioning routine to reduce the load on the patellofemoral joint. So you may want to do shallower squats, so keeping between sort of 0 and 45 degree knee bend. Avoid doing open chain work at the other end of the spectrum, so being careful on the knee extension machine in the gym. Avoid deep lunges past about 50 degrees. And also if stairs is an aggravating factor outside of running, then I would probably stay away from the step ups. Okay, so to recap, when running, try to modify your training to avoid compression on the patellofemoral joint, take down the hills, the intensity, reduce the volume, think about your running style. If pain is more than a 2 out of 10, it's not settling within an hour of stopping running and it's worse the next day, then you probably need to come and see someone like me to have a full assessment and be given a tailored program, as obviously it's not a one size fits all, and there's so many variables with this that need to be taken into account. So that's it for runner's knee. I hope I've answered all your questions. Feel free to get in touch if you have any other worries or concerns, and I'll be back for the final week, week 4, next Thursday. Okay, take care, bye.